I'm audible, right? So before proceeding for this class, we'll ask you that are you comfortable and able to understand, or you want to have some more focus on some other area or need to change something. So first I will be discussing influential point. तो पहले हम इन्फ्लुएंशियल पॉइंट की बात करेंगे. Distal points are over. Yes, right. Over. So in the traditional acupuncture, there are total 8 influential points are mentioned. 8 influential points. Actually, PDF is already, but I will tell you first so that you can able to understand very properly. There are 8 influential points. 1, 2, 3, 4, 5, 6, 7, and 8. So today we are going to discuss about these influential points. आज हम इनकी बात करेंगे. The other name of influential point is Hui meeting point. Now first you read this line, then I will explain. These points strongly influence specific tissue, organ, energy, blood, marrow, vessels, and bone. What is the meaning of that? I will tell you. It is very simple to understand. Like if you see in the India, there are many ministers. Like we are having finance minister who will take only the things connected to the finance. Agricultural minister. Okay. So we have minister for every department. Like for foreign affairs, some other minister. Okay. So we are having many different ministers, right? For so railway minister, agriculture minister, health minister, every day have in the every field we have different minister. Let's take the example of agriculture minister. If any problem happening in the agriculture anywhere in the India from north to south, east to west, so agriculture minister has to reply, has to make some plan so that some पॉजिटिव आउट कैन कम. यानी एग्रीकल्चर मिनिस्टर का काम है कि कुछ भी एग्रीकल्चर में गड़बड़ होता है तो उसे ठीक कैसे किया जाए, किस तरह से सही ढंग से प्लानिंग की जाए, अगर कभी लॉस हो रहा है तो उसे कैसे ना हो होने दिया जाए इन द फ्यूचर. रेलवे मिनिस्टर विल बी डूइंग इफ एनी accident is happening in the railway and all, he will be taking care of that. So there are too many functions in the different part of the India. So for one, we have our government is appointing one minister. For this purpose, government is appointing one another minister. In this way, we are having too many ministers. In the same way, in the human body, there are total 8 ministers. They called influential point. हमारे शरीर में से 8 मिनिस्टर होते हैं जिन्हें हम इन्फ्लुएंशियल पॉइंट कहते हैं. If there is any problem happening in the human body connected with the bone, so we are having influential point of the bone, which is working on this only one tissue, that is bone, urinary bladder 11. If any problem happening related to the bones, like person is having fracture of the bone, degeneration of the bone, in the arthritis, if there is a problem happening with the bone, we will be stimulating urinary bladder, we will be approaching urinary bladder. As we working on the UB11, it will be helping all the bones. ये हमारी सारी bones को heal करता है, help करता है. In the same way, we are having too many ministers in the human body. For example, if there is any problem happening in any yin organ, or any yang organ. So for any yin organ, liver 13, and for any yang organ, CV12. Like any yin organ, like heart, meridian, pericardium, meridian, lung, meridian, spleen, meridian, kidney, meridian, liver, meridian. These all are yin meridian. Any problem happening with any meridian, liver 13 has to work, liver 13 has to take care. लिवर 13 की जिम्मेदारी है अगर किसी भी yin organ में कोई प्रॉब्लम है तो इसको ठीक करना. इन द सेम वे द प्रॉब्लम विद एनी yang organ, there is a responsibility of CV12. Like person is suffering with a problem in the small intestine or the triple wormer or the large intestine or the stomach, urinary bladder or gallbladder. If any problem happening in the any yang organ, then the minister of this is CV12 or the influential point is CV12. If any problem happening with the blood or blood vessels, so the influential point of the blood is urinary bladder 17, and the influential point of the blood vessels is lung 9. So they have to work. ब्लड की कोई भी प्रॉब्लम होगी तो यूवी 17 को काम करना होगा, और ब्लड वेसल्स की कोई भी प्रॉब्लम होगी तो like there is a hardening of the blood vessels, atherosclerosis of the blood vessels, lung 9 has to work. Like I told you, any problem of the bone, UB11, and any problem of the bone marrow, that is gallbladder 39. अगर हमारी बोन की कोई प्रॉब्लम है या फिर बोन मैरो की कोई प्रॉब्लम, तो बोन के लिए UB11 और बोन मैरो के लिए gallbladder 39, they are the influential point. Got it? In the same way, if the person is having any problem with the any tendon, in the human body? Tendon. Tendons are found in the joints. Gallbladder 34 is the influential point. इसका जो influential point होगा वो gallbladder 34 होगा. In this way, we are having total 8 influential point. हमारे शरीर में 8 influential point होते हैं. UV11, gallbladder 39, lung 9, UV17, gallbladder 34, and what else? CV12, liver 13. So 1, 2, 3, 4, 5, 6, 7. Now, one last influential point, that is CV70. That is the influential point of Chi. So UV11 is the influential point of bone. UV gallbladder 39 is for bone marrow. Lung 9 for blood vessels. UV17 for blood. Gallbladder 34 for tendons. CV12 for yang organ. Liver 13 for yin organ. And CB17 for Chi. So there are total 8 influential points. 1, 2, 3, 4, 5, 6, 7, 8. Let's discuss quickly all the influential points. एक बार हम quickly सबको समझ लेते हैं. Let's start with the liver 13. एक बार हम liver 13 से start करो. Like liver 13, I told you a very good point, that is the influential point of all yin organ, or we can tell all Jhang organ. Jhang means yin. Okay. Any problem happening with any yin organ, like I have given the example, liver, spleen, kidney, heart, pericardium, lung, any problem happening with any yang organ, if we stimulate the liver 13, it will improve the function of that organ. It will improve the coordination of that organ. It will regulate the energy in that organ. ये हमारे उस organ को balance करता है. Like we know, the liver is having connection with the stress, so it will work on the stress. Spleen is having connection with the worry and overthinking, so it will work on worry and overthinking. Kidney is having connection with fear and the lower back pain, it will work on the lower back pain. Lung is having connection with the breathing, so it will work on breathing. Heart is having connection with the heartbeat and the palpitation, it will work on the heart conditions. The pericardium also having connection, we can consider heart, it will work on that. So liver 13 is the influential point, very, very important influential point, and it is working on all the 6 yin organ. हमारे सारे yin organ पर काम करता है. Got it? अगर हमने influential point के साथ बस एक distal point जोड़ दिया तो हमारा एक बहुत ही बेहतरीन फॉर्मूला बन जाता है. For example, suppose this is the liver 30, which will working on the heart, pericardium, lung, which is working on the spleen, kidney, and liver. Liver 30, which is working on all yin organ or the jhang organ. Now, suppose one person is having digestive problem. एक व्यक्ति को digestive problem है. We know, just I will take the very simple example. We know digestive problem, the distal point is stomach 36. If we take the liver 30 and add the distal point, then it's become very good formula for all the digestive problem. Because liver 13 will be balancing liver 13 will be balancing spleen, liver 13 will be balancing all organ. Just we add stomach 36, it is becoming very good formula for digestive weakness. We know the distal point of the pelvic cavity is spleen 6. So if we do the liver 13 plus spleen 6, it will become very good formula. But don't worry, right now I'm giving you example. We will make the protocol using TADI. T means tranquilizer, A means analgesic, D means distal point, and I means influential point. We will mix all four and we will make the protocol after some time. कुछ समय के बाद अभी मैंने सिर्फ आपको एक उदाहरण दिया है कि हम कैसे बनाते हैं. So we have understood about the liver 13. Liver 13 is very, very important points. And how to locate this point? हम इस point को कैसे locate करेंगे? Liver 13 point is located on the tip of 11th rib. हमारी जो 11वें नंबर की पसली होती है, the tip of 11th rib. Liver 13 is located there. Now first I will show you one image, then you see. Look at here. Now we can see the liver 13. Liver 13, you can see the image here. This is the image of the liver 13. Now look at the ribs. This is located on the tip of ribs. That is below the free end of 11th rib. ये 11वीं पसली के फ्री एंड पर होता है. अब या तो आपको पसलियां गिनना आती हो, है ना, लेकिन आपको अगर पसली गिनना नहीं आती तो फिर दूसरा उपाय. So first you can see if someone is very lean and thin. If any patient is very lean and thin, then it's very good for you because you can count the ribs. आप पसलियां गिन सकते हो उसकी. So let's see here, there are the multiple ribs here. 12 pair ribs, 12 rib on the right side, 12 rib on the left side. That is why we are telling 12 pair ribs. हमारी 12 पसली ribs होती. But the last two rib are called floating rib. Floating. हमारी जो नीचे की सबसे दो पसली होती है, the 11th and the 12th rib are called floating rib. Look at here in this image. We can see here the last two ribs will be floating. So here you can see very clearly, this is the 11th number rib and this is the 12th number rib. The liver 13 point located on the tip of 11th rib. Tip of the 12th rib also we are having some other very good point which we will discuss when we are going to discuss front mu point or the alarm point. Right now not. Right now our target is only the tip of 11th rib. That is liver 13. तो टटोलना है जहां पसली मिलेगी उसका टिप. How to do that? So we will be standing like this. Then we will feel where this pointed part of the elbow is coming at that level. We are having 11th rib. Now here we will go and we'll try to search the tip. I got it. I, I can pass it. So this is the point, and you can see exactly at this point. This is the point. I can feel the tip of 11th floating rib, that is liver 30. When you press, patient will shout because most of the patient is having pain here. इस पर दर्द मिलता है अक्सर. If the person is having stress, then you will find too much pain. But if the person is having problem with any organ, this might be painful. तो ये हमारा पहला बिंदु था इन्फ्लुएंशियल पॉइंट में लिवर 13. नाउ लेट्स मूव टू द, आप सुजोग में आप देखिएगा, राइट नाउ आई विल नॉट discuss about the sujog location. Okay, maybe in the future, but not right now. Sujog, you can see the chart. Okay, so now B will be moving to point number next, that is CB12. अब अगले पॉइंट की तरफ आगे बढ़ रहे हैं, that is CB12. Which is the influential point of all young organ? So whether we talk about the stomach meridian or the gallbladder meridian or the urinary bladder meridian, or we talk about the small intestine triple wormer or the large intestine meridian, if any problem happening with any young meridian, CB12 is the very good point, influential point of all the young organ. It harmonizes the stomach, it harmonizes the gallbladder, urinary bladder, large intestine. It regulates energy in these all meridian. Okay. If the person is suffering with a gastritis or any problem with the gallbladder or lots of acid reflux, indigestion, nausea, vomiting, because we will use CB12. The best point for all the hollow organ or all the young organ, CB12. So CB12 is the master point. How to locate CB12? कैसे locate करते? We have to see the navel. हमें नाभि देखना है. Navel. Wherever the navel is. Suppose this is the navel area. And this is the lower end of the sternum bone. This is lower border of sternum bone. So draw the line in between navel and the lower border of the sternum bone. In this line, exactly in the center, this is the location of CB12. So this is near about fortune, above the navel area. नाभि से आप अगर 4 चुन ऊपर जाते हैं, so look at here in this image, from the navel area, if you go 4 chun above, look at in this image. So from the navel area, 1 chun, 2 chun, 3 chun, 4 chun above, CB12 is located. So midway between navel to sternum, the lower end of the sternum. This is the influential point of all young organ, but note down very important thing. This is a very good point to stop फ्लेम इन द बॉडी। हमारे शरीर में फ्लेम को रोकने के लिए अगर आपको सिर्फ एक पॉइंट यूज करना हो, ये कर सकते हैं। सपोज यू जस्ट वांट टू यूज वन सिंगल पॉइंट in the human body to stop the formation of the flame, kapha, dampness. You can use CB12. CB12 is very good point to stop the formation of flame, dampness. But the most important point for young organ, influential point. So whenever you are making protocol, someone is suffering with stomach problem, CB12, gallbladder problem, CB12, large intestine problem, CB12, small intestine problem, CB12. Whenever we are making protocol and the person is having any problem, you can add CB12. One more information, you can also add it if the person is having problem of spleen, because this stop the formation of flame. Spleen is weak, then making the flame. Okay. So this was the second influential point. Now the third influential point I'm talking about it, very, very important influential point, that is CV70। अगले influential point की बात करते हैं। इसका नाम है CV17, CV70। We can see in this image, in between both the nipples, हमारी दोनों निपल के ठीक मध्य में, in between both nipple, this point is located, CV17। CV17 is very good influential point for chi. It is the influential point of chi, center of chest। ये हमारे छाती के सेंटर में होता है, exactly in between both the nipple। We are using this point for all the chest condition। हम इसे chest की condition के लिए यूज करते हैं, like for tightness of the chest, for problem of the chest, for any problem of the chest like breathing problem and all, we use this point। So when we use this CV17, we are using it for all the chest problems। It is the influential point of chi। Person is suffering with asthma, we can use this point। This point regulate the energy। We are using for some tightness of the chest, some emotional tightness of the chest, emotional stress, palpitation, any problem of the chest, whether the problem of the heart or the lungs or the breathing problem or the heart beating problem, any problem which is having connection with the lung and heart, we can use CV17। When the chi is blocked in the chest especially, use CV17। As soon as we work on the CV17, it will open the chi blockage from the chest। That's why many people are using this point for asthma। कई लोग इसे अस्थमा में प्रयोग करते हैं, कई सारे लोग तो इस पर कैटगट का धागा डालते हैं, कैटगट का धागा डालते हैं, and this point really works very nicely। In the China, they put the needle here and they just उसे पड़ी रहने देते हैं, निडल इम्प्लांटेशन कर देते हैं, अंदर ही डाल के रख छोड़ देते हैं। And in many countries, including India, few people are doing catgut therapy। Catgut therapy, so they आजकल surgical thread, they dissolve automatically, है ना, वो अपने आप पिघलने वाले कांट आते हैं ना टांके, उन्हें लगा दिया टांके को, छोड़ दिया, अपने आप पिघल जाएगा 1 महीने में, 20 दिन में। So this stitches dissolve automatically, they're putting below the I think press needle will be irritating a lot all the time because press needle we are putting for longer duration. It will irritate a lot. Okay, for needle it's okay. You are putting the needle for 40 minutes, 30 minutes, then you are removing the needle. But you put the press needle. Okay, might be good, but I think not required to put for longer time. So needling is enough 30, 40 minutes. So CV17 is a very good influential point for opening the chi from the chest area. छाती में ऊर्जा की रुकावट को दूर करता है. Definitely liver 13 is very good for all yin problem, including yin deficiency. So now we are moving to the next point. That is urinary bladder 17, UB17, urinary bladder 17. It is very simple to locate the urinary bladder 17. Urinary bladder 17 is the point found on the back side. So look at here in this image. UB17. It's a very easy to find. UB17. So we are talking about the point UB17. Influential point of blood. So the person is having blood deficiency or the blood stasis or any condition where blood is coming, we are using blood, we will use UB17. UB17 is the influential point of blood. So just see the lower border of the scapula. This is the lower border of the scapula. So we are drawing a horizontal line at the lower border of the scapula. UB17 found at this line. हमारा UB17 इस लाइन पे होगा. दोनों स्कैपुला के लोअर बॉर्डर को मिलाया और एक हॉरिजॉन्टल लाइन ड्रॉ कर दी. Urinary bladder 17 located in this line. From the center, you have to go 1.5 chun on side. 1.5 on this side. This is the location of UB17. Now remember this thing, it is very, very important point. I will tell you why. When I'm telling you blood, you might be thinking, okay, means blood deficiency, means anemia. Okay, that is okay, right? That is not wrong. You can use for anemia. You can use for blood deficiency. आप ब्लड डेफिशिएंसी के लिए तो UB17 का प्रयोग कर ही सकते हैं और लगाना ही पड़ेगा. इसके बिना प्रोटोकॉल अधूरा होगा क्योंकि ये मिनिस्टर है. But other problem like I'm telling, blood stasis. Blood stasis का मतलब है गांठें. Like what is the meaning of blood stasis? The meaning of heart blood stasis. Heart blood stasis means angina pain, heart attack, chest pain, coronary heart disease, angina pain. Blood stasis means sharp pain anywhere. Very, very sharp pain. Very sharp pain. Like someone is poking with a knife. कोई ऐसे चाकू घोंप रहा है. That is sharp pain, poking pain. Anywhere like in the heart because of the blockage, or in the stomach because of the stomach ulcer, or in the uterus because of uterine fibroid, or in the ovary. When the person is having sharp and the poking pain, too much pain, fixed pain, that is blood stasis. We are using many words like heart blood stasis, stomach blood stasis, liver blood stasis. UB17 is mandatory to put whenever we think blood. जब भी हम ब्लड की बात करते हैं, ब्लड स्टेसिस से ही गांठें बनती हैं. जो हमारे शरीर के अंदर जो गांठें बनती है, ध्यान रखिएगा मैं लाइपोमा की बात नहीं कर रहा हूँ, लाइपोमा इज अ डिफरेंट कंडीशन। हमारे शरीर में जो गांठें बनती है अंदर, लाइक polycystic ovary, uterine fibroid, thickening of the uterus, or even lump nodule in the breast, or any nodule formation anywhere in the body, that is blood stasis. Even cancerous nodule, they are the higher level of the blood stasis, very, very higher level. UB17 will be there. You have to take UB17 and put in the protocol. UB17 को उठाओ और प्रोटोकॉल में डाल दो। UB17, you can stimulate UB17, you can do guasha. Guasha means you ragadna UB17, scrubbing of the UB17, needle on the UB17, cupping on the UB17, blood relating on the UB17. Blood relating is very good if the person is having blood stasis. Why? Blood stasis means very deeper level of the blockage. You can do blood cupping, but if you don't want to do blood cupping, just do scrubbing, or you just do needling, or you just do acupressure. You can stimulate anyway. So UB17, UB17 is the very good point, 1.5 twin away from the spine, and it is nourishing the blood, it is removing the blood stasis, it is cooling the heat of the blood, it is working on the blood stagnation. Like female is having any problem with the menstrual bleeding, that is also blood UB17. If any problem is happening in the female which is having connection with the menstrual bleeding, UB17. So UB17 is the most important point for all the blood disorders and any circulation problem. Generally, in the acupuncture, when we are using, when we are making any protocol of blood, we put 2 points. One is UB17 and another one is spleen 10. Spleen 10 is also very good special point of blood. जब भी हम ब्लड का कोई भी फॉर्मूला बनाते हैं तो हम स्प्लीन 10 को भी मिला देते हैं। तो एक बहुत ही बेहतरीन फॉर्मूला बन जाता है। So now we are moving to the next part. That is gallbladder 34. Very, very important. Gallbladder 34. In the left, I already have told you the location of this point. You can see the video of day 3. In the day 3, I have demonstrated the gallbladder 34, how to prick the needle on the gallbladder 34, how to search the gallbladder 34. I told all about the gallbladder 34. So I will not demonstrate this point once again. You can see the day 3 video. But I will tell you here, we are having two bones. One is this bone, that is called tibia bone. This is the fibula bone. The gallbladder meridian going on the border of this fibula bone. And when we are reaching on the top, that is gallbladder 34. ये हमारा gallbladder 34 है. Gallbladder 34 is the influential point of all the tendons. So tendon means joints, in the joints. Tendon का मतलब क्या होता है? Tendon is a very important structure of the human body, giving very wonderful support. हमारी पूरी बॉडी को सपोर्ट देता है। जैसे हमने टेंट गाड़ा, एक रस्सी बांधी और रस्सी को खूंटे से बांध दिया तो टेंट गिरेगा नहीं। ऐसे हम क्या करते हैं, टेंडन क्या होते हैं, टेंडन मसल में बांधते हैं और हड्डी में ठोक देते हैं। टेंडन मसल से लेकर हड्डी में ठोक देते हैं। तो क्या है, बहुत अच्छी स्टेबिलिटी देता है। मसल को खींचा तो वो हड्डी भी मूव होती है। So the tendons are the structure who are giving very good support. On one side they have muscles, on the other side they have bones. So they are attaching muscles with the bones. For example, आप देखिए टेंडन वाला, सब जानते हैं एक्चुअली टेंडन, ये हमारा पैर का, this actually is tendon. Here we have bone, and here we have calf muscle. So calf muscle, this muscle, then actually is tendon, then bone. So this tendon is connecting muscle with the bone. Now, if I squeeze this muscle, so with the help of tendon, I can work on the bone. So they are providing very, very wonderful support. With many tendons, like we can see that this is a tendon. We can feel one hard structure here, tendon. In between. Tendons are very hard. We can see in between the elbow here. We will feel one tendon. If you bend your elbow, you will feel one tendon. So tendons are very, very hard structure. They have very good rigidity, so they can provide the support. Now you can understand if the tendons are having problem, entire joints will be having problem. There will be great problem with the movement. So gallbladder 34 is the very good influential point for all tendon, any tendon anywhere in the body. Like we are having one tendon here, that is called, एक यहाँ पर टेंडन होता है, इंजर्ड हो जाता है, that is called tendon of supraspinatus muscle. So there are many patients coming in the clinic, they are telling doctor I am suffering with the shoulder pain, and actually this problem is called tendinitis. जो फ्रोजन शोल्डर होता है ना वो अलग होता है, टेंडिनाइटिस अलग होती है. सारे शोल्डर के पेन फ्रोजन शोल्डर नहीं होते. All the shoulder pain are not frozen shoulder. Some pain might be frozen shoulder, but the some pain might be tendinitis. Okay, both are different condition. Okay, so we are having tendon everywhere in the body. So here if we do the movement, we can feel the movement of the tendon at the location of Li15. If you know the location of Li15, if you do the movement here, you will feel the movement of the tendon. So there is a difference between tendinitis and the frozen shoulder. If the problem of the tendon and the frozen shoulder, बहुत बड़ा डिफरेंस होता है. गहराई में जाओगे तो दोनों का ट्रीटमेंट भी अलग अलग होता है. Okay. So in this way, when you want to work on any tendon, take influential point, that is gallbladder 34. कौन सा पॉइंट लेना है? Gallbladder 34. So gallbladder 34 is not only good for tendon because it is attaching muscle with the bone. It is also very good for tightness of the muscles. Any joint pain, we can take gallbladder 34. Right? Tightness of the muscle, tendon problem. Okay, so I would like to tell you, मैं यहाँ पर दो चीजें लिख देता हूँ. The gallbladder 34 we are using for problem of tendons, for problem of muscle, and the problem of nerve. Nerve are having connection with the brain, that we know. So gallbladder 34 we are using for these conditions. For example, any problem of the tendon like tendinitis, like shoulder pain or stiffness, or any muscle problem like tightness of the muscles, or any nerve problem like someone is suffering with a paralysis. So motor nerve are not functioning well. So gallbladder 34 can be used for tendon, gallbladder 34 can be used for ligaments, gallbladder 34 can be used for muscles and nerves. Remember this. तो गॉलब्लैडर 34 का प्रयोग हम टेंडन, लिगामेंट, मसल और नर्व के लिए करते हैं। आपके सामने पेशेंट आया, मसल पेन गॉलब्लैडर 34, मसल स्पाज्म गॉलब्लैडर 34, मसल टाइटनेस गॉलब्लैडर 34, टेंडन प्रॉब्लम, टेंडन टियर गॉलब्लैडर 34, ligament problem gallbladder 34, rupture of the ligament in the knee gallbladder 34, nerve problem gallbladder 34, paralysis gallbladder 34. Gallbladder 34 is one of the great influential part. If you find the pain of the calf muscle, if it is muscle, then you can use gallbladder 34. Okay, now let's move to the next. So we can definitely we can work on the ligament here. If ligament tear, there are two type of ligament tear. One is 100% tear, we cannot work. If there is a partial tear, we can work. अगर ligament 100% tear है, हम काम नहीं कर सकते. टॉन सेडेट, अभी तो हमने आपको प्रोटोकॉल ही नहीं बताया, तो हम टॉन सेडेट कहाँ से बताएंगे? अभी हमने प्रोटोकॉल, अभी तो हम आपको बता रहे हैं कि गॉलब्लैडर 34 फॉर टेंडेंस. टॉन सेडेट तो कंडीशन के ऊपर डिपेंड करेगा. So now we are moving to the next point, very, very important point. One of the very great point, that is gallbladder 39. So we already know the gallbladder meridian is on the anterior wall of the fibula bone. So from the ankle joint, if we are going 3 chun above, we are getting gallbladder 39 point, which is the influential point of bone marrow. We know this is the bone, and inside the bone we are having bone marrow. हमारी बोन होती है, और बोन के अंदर क्या होती है? बोन मैरो. In the Ayurveda, many Ayurveda doctor are taking out the bone marrow and making one herbal oil, very good for scalp hair. Bone marrow is very good for brain and scalp hair. बोन मैरो का प्रयोग करके सिर के बालों में और ब्रेन की ताकत को बढ़ाया जा सकता है. इट इज वन ऑफ द वेरी गुड. बोन मैरो इज गिविंग energy to scalp or brain, or we can tell brain is made by bone marrow. Oil name I don't know. I don't know which company is making, but I have seen in my Ayurveda college the people who are making bone marrow. Even you can see that there is a one protocol of the kidney essence. Gallbladder 39 is there. Kidney essence is very good for hair regrowth and also for bone problem, osteoporosis of the bone. So gallbladder 39 is very good for brain. It is giving strength to your brain. It is making the structure of the brain. Brain is made by bone marrow. Brain का निर्माण bone marrow से होता है. Now you see, if the bone marrow is weak, what will happen? Brain will be weak. Memory will be weak. Person might having dizziness, falling of the scalp hair. Even the person might get paralysis if the brain is too weak. The person might be having too many neurological problems just because of the marrow deficiency, bone marrow deficiency. So bone marrow is very, very important for brain and spinal cord and the nervous system nourishment. Remember this. बोन मैरो बहुत जरूरी है किसके लिए? ब्रेन के लिए, स्पाइनल कॉर्ड के लिए और नर्वस सिस्टम को नरिशमेंट प्रोवाइड करने के लिए. So whenever you see this, this patient is having any problem of the brain, or this person is having any problem of the spinal cord, or the nervous system problem, or the weak memory, or the dizziness, paralysis, any neurological problem, use gallbladder 39. That is the influential part of bone marrow. It will benefit your brain. It will nourish the bone marrow. It will improve the nervous system functions. That's why gallbladder 39, जैसे किडनी सेंस का प्रोटोकॉल बनाते हैं उसमें तो टॉन करते हैं, राइट? लेकिन कोई दूसरा प्रोटोकॉल बनाएंगे तो क्या करेंगे, विल सी. बट राइट नाउ आई विल टेल यू व्हेन वी आर मेकिंग द प्रोटोकॉल ऑफ द किडनी सेंस, we are doing the tonification on this point. Got it? So gallbladder 39. So let's say the needle here. This needle is also very good. I am using this needle also. There's a tonic compound. This is also very good. So first to take out take the packet, open the packet, take out the needle. You can also take out the cube, because with the cube needle become less painful. Make sure follow proper hygiene. Don't keep the needle on the bed like this. Let it be there inside. The tip of the needle should be very neat and clean. Otherwise, there might be chances to have some infection, some bacterial infections. If you want to do the very clean needle practice, clean the area where you are needling the point. Then how to needle, look at here. So first you have to look at the gallbladder meridian. So this is the lateral malleolus. From the midpoint of the lateral malleolus, I will go 3 chun. That is the gallbladder 39. I can feel the bone here. Then I can put the needle here. So this is the gallbladder 39. Okay? Anterior to the bone. It is not painful. It is very simple to insert the needle here. Just anterior to the bone. So we have covered liver 13, CV12, then urinary bladder 17, gallbladder 34, gallbladder 39. Let's go to the next influential point. अब अगले influential point की बात करते हैं, lung 9. So lung 9 is here. Suppose we are नाड़ी check कर रहे हैं किसी की, we are checking the pulse. We are keeping the 3 finger, index finger, middle finger, ring finger. So where the index finger is coming, that is the location of lung 9. यही lung 9 है. तो देखिएगा यहां पर हम ऐसे needle लगा सकते हैं. We can put the needle here like this, or we can put the needle like this, or in the opposite direction on the lung 9. So lung 9 is the influential point of blood vessels. पेन नहीं होता, पेन नहीं होता। और होता भी है तो थोड़ा सहन कर लेते हैं, इतना ज्यादा नहीं होता। वी आर गेटिंग, when we are needling, we are thinking, oh, we will be getting, we are thinking for fruit, then there is no pain. Fruit के बारे में सोचो, oh, I will get my all the blood vessels will be very good. If I'm putting this lung 9 is the very good influential point for blood vessels. It will regulate the blood vessels. It will improve my lung chi. It will improve the circulation. It will strengthening the pulse. If the person is having weak circulation, weak pulse, lung 9 is the very good point for the lung, for the respiratory problem, and for any vascular problem. There is some blockage inside the blood vessels, there is hardening of the blood vessels, there is any problem of the blood vessels, we will use lung 9. Important point for blood vessels disorders. जब हमारी ब्लड वेसल्स के अंदर कोई ब्लॉकेज भी हो जाता है तब भी हम लगाते हैं, बिकॉज दैट इज ऑल्सो द प्रॉब्लम ऑफ द ब्लड वेसल्स। लंग 9, like in the COVID-19, in during the treatment of the COVID-19, there were few points, but one point was lung 9. Why? Because COVID was creating narrowing of the blood vessels also. जो कोविड कर रहा था ना, कोविड because of the COVID virus, people were getting narrowing of the blood vessels also. So because COVID virus was affecting the blood vessels, so lung 9 was there in the protocol of the COVID-19 also. Any problem with the blood vessels, we will use lung 9. Lung 9 is very good point for improving the lung chi, respiratory problem, improving blood vessels. Blood clot, infarct, any problem inside the blood vessels. Lung 9 is very good point for varicose vein, any problem which is connected to the artery or the vein. Any problem the artery, any problem the vein, even the person is. So we can use this point for multiple problem of the blood vessels. Right? Because what is happening, that is a condition that is called arteriosclerosis. एक कंडीशन होती है जिसे कहते हैं arteriosclerosis. What is the arteriosclerosis? I will tell you. आपने देखा होगा कि हमारे घर में जो गैस लाइन होती है ना, गैस की लाइन, जैसे वाली मैं लाइन दिखाता हूँ, ये देखो, ये देख रहे हो, ये पाइपलाइन, ये जो लाइन होती है ना गैस लाने वाली, इन फ्यू इयर्स इट बिकम वेरी वेरी हार्ड। कुछ सालों में कितनी हार्ड हो जाती है, देन वी हैव टू चेंज इट। Initially, it is very loose and flexible, having very good elasticity. But after 3-4 years, it become very rigid and hard. Is it or not? बनती है ना? What is called? That is called hardening and rigidity of the pipeline. The same thing happening in the blood vessels. It is called arteriosclerosis. The hardening of the artery. artery losing the flexibility because artery is also having elastin fiber, collagen fiber, which is maintaining the toughness and the elasticity of the artery. हमारी आर्टरी के अंदर भी तो होते हैं इलास्टिन फाइबर कोलेजन फाइबर बट विद द ईयर इट बिकम वेरी टाइट एंड हार्ड आप इसे बदल तो सकते नहीं है तो उसे रिपेयर ही करना पड़ेगा लंग नाइन इज अ वेरी गुड पॉइंट फॉर दैट लंग नाइन इज वेरी गुड पॉइंट फॉर इम्प्रूविंग द blood vessels. Okay, now we are moving to the next influential point. Very, very good influential point, that is UB11 or the urinary bladder 11. We know we are having 7 cervical vertebrae total. So this is the C1, C2, C3, C4, C5, C6, C7. And this is the thoracic one, then the thoracic two. So we are having total 7 cervical vertebra. Then there is a thoracic vertebra. So let's focus on the thoracic one. Just below the thoracic one, we are having urinary bladder A11, both the side bilateral, 1.5 cun away from the midline. हमारी मिड लाइन से अगर हम 1.5 दूरी पर जाते हैं तो हमें मिलता है UB11, which is the influential point of all bones. This will strengthen the bones, this will benefit the spine, this will nourish the bone. ये हमारी बोन को ठीक करेगा. If there is osteoporosis, osteopenia of the bone, if there is a calcium degeneration in the bone, weakness of the bone, if the person is suffering with a pain in the bone, cervical bone pain, thoracic bone pain, lumbar bone pain, of the spine disorder, this is a very good point for all the bones and the skeletal system. तो जब भी हमारे शरीर में कोई भी स्केलेटल सिस्टम की वीकनेस आती है तो हम इस बिंदु का प्रयोग करते हैं. कौन सा पॉइंट रह गया बताइए जरा. तो एक छूट गया है, कौन सा रह गया. आउट ऑफ द 8 influential point, if any left. All done? Very good. So we have discussed 8 influential point. Got it. I told about the urinary bladder 11, which is the influential point of bones. Any problem of the bones. हमारे शरीर में कोई भी जो बोन की प्रॉब्लम होती है, हड्डियां कमजोर हो जाती हैं, हम UB11 का प्रयोग करते हैं. अब मैं आपको क्विज दे रहा हूं. आई एम गिविंग यू क्विज. सो फर्स्ट आई एम गिविंग यू क्विज of how many question quiz you want? 10 question or 20 question? Okay, let's start. If you're not got the quiz in your group, please just message me. Then I will put the quiz in your group. So I have put the quiz in the final group of the postgraduate diploma and few other groups. सबका नंबर 1 है क्या? अच्छा जी, 1.
I'll read.
कौन पढ़ेगा?
मैं पढ़ूंगी.
हाँ पढ़िए, स्टार्ट करिए. मैं आपको दिखाऊं स्क्रीन पर क्या?
Yes, sir.
स्क्रीन पर दिखाऊं?
हाँ
एक
जी.
मिनट, 1 मिनट. आई विल शो यू. की आवाज कैसी आ रही है? हाँ, स्टार्ट करिए.
Which point is influential point of blood? D. Bladder 70.
Bladder 17.
Bladder 17.
So everyone has to reply. The answer will be bladder
17.
17. Question number next. Please mute everyone. Those who are speaking in their home. Unmute again. Yeah. Next one. Unmute. Question number 2.
Which point is influential point of tendons? Option B, GB34.
34.
GB34.
Answer will be gallbladder 34. Question number 3.
Which point is influential point of marrow? C, GB39.
GB39.
39 is the point of marrow. Question number 4.
Which point is influential point of chi?
A.
Option number A, C17.
CB70, influential point of chi. Question number 5.
Which point is related to bones? Option B,
L11.
LU9C.
So bone.
Ladder 11.
The question is bone. Question is bone.
Bladder 11.
Bladder 11. Question number 6.
Which point is influential point of vessels? Option C, lung 9.
LU9.
Lung 9. Question number 7.
Which point influences the Fu organs?
CB12.
12.
Who
Option
means
C,
yang
CB12.
organ? So CB12 is the influential point of all the yang organ. Question number 8.
Which point influences Zhang organs? Option A,
Liver
Liver
13.
13.
So liver 13 is the yang or the yin organ. Question number 9.
GB34 is mainly used for which structure? Option D, tendons.
Tendons.
So tendon means gallbladder 34. Question number 10.
UB17 is commonly used for which disorder? Option B, blood disorder.
Blood disorder.
UB70 is the influential point of blood. So using the blood disorder, question 10 is over. Question number 2. Question number 1.
Which point is known as the influential point of bones?
Bladder 11.
Ladder 11.
So bladder 11. Yes.
Next question. Which influential point is located on the wrist? Option C, lung 9.
LU9.
So lung 9 located on the wrist. Yes. Question number 3.
Which point is used for digestive disorders of Fu organs? Option number A, CB12.
CB12.
CB12. Yes. Very good. Question number 4.
Question. Which point is located near the head of the fibula? Option B, GB34.
34.
So gallbladder 34 is located at the head of the fibula. That is the influential part of tendon. Question number 4. Answer B. Question number 5.
Which point is mainly related to respiration and chest chi? Option C, CV17.
CB17.
CV17. Yes, the influential point of chi and the chest chi. Question number 6.
Which influential point is used in anemia and blood deficiency? Option A, UB17.
Ladder 17.
Bladder
Bladder
17.
17 is the very good point for blood deficiency and anemia. Question number 7.
Which point is called the influential point of marrow? Option B, GB39.
39.
Gallbladder 39. That is the influential point of marrow. 8.
Which point is located below the free end of the 11th rib? Option C, liver 13.
That is liver 13. Question number 9.
Which influential point is commonly used in muscle stiffness? Option B, GB34.
GB34 is very good to use in the muscle stiffness. Yes. 10.
Lung 9 is the influential point of what? Vessels.
Vessels.
So lung 9 is the influential point of blood vessels. Okay, done. So very good all of you. बहुत अच्छा आप लोगों ने लगभग सभी आंसर सही से बताए. Any question related to this? Anyone?
सर आपने बहुत अच्छा पढ़ाया है.
Thank you.
सर सिर्फ एक गॉल
आपने बहुत
ब्लैडर
अच्छे जवाब दिए उसके लिए भी थैंक यू.
सर GB34 का पोजीशन बता दीजिए ना सर. केशन
GB34 का पोजीशन तो उसमें बताऊं इमेज में
सर,
कि पैर में.
नहीं आपके पैर में सर.
नर्व्स वीकनेस का सिम्टम्स क्या होता है सर?
इसका सिम्टम क्या क्या क्वेश्चन?
नर्व वीकनेस का सिम्टम्स क्या होता है?
नर्व वीकनेस का
हाँ, और उसका पॉइंट अच्छा कौन सा है? एक पेशेंट है उसको
हाँ, अभी प्रोटोकॉल
हीटिंग,
डिस्कस नहीं करें।
नहीं नहीं
प्रोटो
प्रोटोकॉल नहीं चाहिए सर। उसका फीट में सुई जैसा होता है
हाँ,
ना।
तो वो सुई जैसा होता है, वो नर्व का ही है।
हाँ
तो देखो, उसे कहते हैं न्यूरोपैथी। जैसे डायबिटिक न्यूरोपैथी होती है, कई लोगों
हाँ
को हो जाती है। पैरों
हाँ।
में सुई चुभना, प्रिकिंग
ओके।
सेंसेशन, नमनेस होना,
हाँ।
पैरों में जलन होना, पैरों में गादी जैसा लगना, गद्दी
गादी
जैसा
का
फील
मतलब
होना।
क्या
जैसे
है?
ऐसा लगता है कि जैसे कशन पर चल रहे हैं, गद्दे पर चल रहे हैं,
ओके।
वो
ओके।
फीलिंग आती है।
ओके।
I will show you the location of gallbladder 34. Let's see now. ये तो पेंट ऊपर जाएगा नहीं।
करना तो पड़ेगा इसमें।
ओके, चलो। पहले मैं म्यूट कर दूं, बहुत आवाजें आ रही हैं आपके यहाँ से। Okay, let's see now. So we can see this is the tibia bone, and on the side this is the fibula bone. So on the anterior part of the fibula bone, that is the gallbladder meridian. So I will palpate the anterior part of the fibula bone. I am keep palpating the anterior part of the fibula bone. Now I can see I will reach on the tip top. मैं इस फिबुला बोन के एंट्री बॉर्डर को फील करता हुआ जहां तक जा सकता हूं वहां तक जाऊंगा, यहां तक पहुंच गया। अब इसके बाद अगर मैं गया तो मुझे हड्डी मिलेगी, बॉर्डर नहीं मिलेगा। सो दिस इज द टॉप प्रोमिनेंस, द लास्ट पार्ट वेयर आई कैन फील द एंटीरियर बॉर्डर। यहां के बाद मुझे एंटीरियर बॉर्डर फील होना बंद हो जाएगा। और फ्रॉम द पटेला, ये जो पटेला होता है ना, ऑन द नी क्रीज, फ्रॉम द नी क्रीज इफ आई कीप फोर फिंगर, ये जो क्रीज होती है ना घुटने की, फ्रॉम द नी क्रीज इफ आई कीप फोर फिंगर, आई विल रीच नियर अबाउट दैट एरिया। So I can feel the anterior border of the fibula bone. This is the location of gallbladder 34. I will feel this point. I will feel the anterior border of this, and I can prick the needle here. You can see this is the needle. Okay. So this is the location of gallbladder 34. ये हमारे gallbladder 34 की लोकेशन है। नहीं जी, ये घुटने की आंख नहीं है। घुटना तो ऊपर है। देखो, ये घुटने के नीचे है। घुटने से तो ये 3 चुन नीचे है, घुटने पॉप्लेटल क्रीज से। आपको कोई कंफ्यूजन नीलम, नीलम जी? Having any confusion to locate this point? We will feel the anterior part of the fibula bone. We will feel the depression there. घुटने की आंख ऊपर है। I will show you the घुटने की आंख. Let's see this. ये घुटने की आंख तो ये है, ये घुटने की आंख। This point is located here, यहाँ पर है। The anterior border of the fibula bone. ये घुटने की आंख है। This is the knee eye. अगर ये पॉप्लिटल क्रीज को देखें, यहां से लगभग 4 अंगुल नीचे पॉइंट है गॉलब्लैडर 30। ये घुटना है, देखो। इसके लिए आपको फिबुला का बॉर्डर फील करना है। फिर पॉइंट को लोकेट कर। यस नीलम जी।
Sir, two questions. One that can we use the bear location जो
क्या
हमारे
फिर से
हाथ
रिपीट
जो
करिए।
सर बायो जो बेयर लोकेशन होती है हाथों में कैन बी यूज दैट फॉर
Yes,
GB34?
you whatever point we are discussing, you can use in the view all the points. Can use in the
एंड अनदर पॉइंट है सर कि इसके कितनी क्लासेस निकल गई हैं अगर हम एनरोल करें और कितनी ड्यूरेशन है कोर्स की
अभी तो
सर्टिफिकेशन
इंट्रोडक्टरी
कोर्स
क्लासेस चल रही है। अभी हमारी आज 5वीं क्लास है।
और सर ये 1 ईयर का कोर्स है
ये 9 मंथ का कोर्स है।
और वी विल गेट द डिप्लोमा विच इज रिकॉग्नाइज्ड राइट?
इसमें आपको मिलेगा पोस्ट ग्रेजुएट डिप्लोमा। ये डिप्लोमा के ऊपर का कोर्स है।
ठीक है, थैंक यू।
यस ज्योति नायडू जी।
सर मेरी डॉटर को अभी सडनली 2-3 वॉमिटिंग्स हो गया और डिजीनेस आया है, तो मैंने CV12 को प्रेशर दिया था, CV12 और पेरिकार्डियम 6 में, और चक्कर आ रहे, तो मैं LI4 में भी प्रेशर दिया है, तो और कुछ पॉइंट में यूज कर सकती हूँ सर उसमें?
देखिए अभी हम इस तरह से प्रोटोकॉल डिस्कस नहीं कर सकते। यू कैन सेंड मी
ठीक है,
मैसेज, आई विल रिप्लाई।
या ओके ओके थैंक
ये नेहा जी।
सर क्विज नंबर 2 में जो थर्ड क्वेश्चन है, विच पॉइंट इज यूज फॉर डाइजेस्टिव डिसऑर्डर्स एंड फूड ऑर्गन्स। सो आई थिंक फूड ऑर्गन मेरा कुछ गड़बड़ हुआ है, बट इसमें सर लिवर 13 भी बताया था ना आपने अभी। लिवर 13 में आपने बताया था डाइजेस्टिव सिस्टम में प्रॉब्लम होता है तो लिवर 13 यूज करते हैं।
विच पॉइंट इज क्वेश्चन नंबर
3, क्विज 2।
ओके। question number 3, which point is used for digestive disorder and the food organs? देखो digestive disorder and the food organ, so CV12 is the influential point of all the food organ. Gallbladder 39 is for marrow, bladder 11 for bones, lung 9 for blood vessels. So CV12 will be used. मैंने बताया था कि CV12 is the influential point of all the young organ. So stomach, gallbladder, small intestine, large intestine, all the young organ, we can use CV12. मैंने वो
ओके।
लिवर 13 बताया था। लिवर 13 के कॉम्बिनेशन में मैंने, वो तो हम प्रोटोकॉल में सीखेंगे। लेकिन अभी मैं आपको बता रहा हूँ कि यहाँ पर जो है कि फू ऑर्गन CV12 के भी एक ऑप्शन बचता है हमारे पास।
जी, फूड ऑर्गन का लेंगे इसमें हम।
हाँ,
ओके, पर लिवर 13 भी सही है आंसर सर,
इसमें
अगर
ऑप्शन ही नहीं है।
फू ऑर्गन नहीं हो तो।
पहली बात तो फू ऑर्गन नहीं हो, दूसरा ऑप्शन भी तो होना चाहिए लिवर 13।
क्विज का आई अंडरस्टैंड, उसमें फू लिखा है, बट अगर
क्विज ही
फू
बदल जाएगी
नहीं है
फिर।
तो।
हाँ, क्विज बदल जाएगी।
जी सर।
ओके। यस विशालाक्षी।
Sir, ये quiz number 2, eighth question answer is below the 11th rib, below the free end of 11th rib, bladder 17 sir or liver 13 sir?
So quiz number 2, question number 8, right?
Yes sir.
Which point located below the free ends of 11th rib?
Rib.
बताइए।
Liver 13.
Yes, right. Liver 13.
Sir, but bladder 17 is below the scapula, but it is not the 11th rib sir.
No, there is far distance from the lower border. The lower border is located at the level of 7th rib. The
Okay
lower
sir.
border of the scapula is, ये देखिएगा, बहुत दूरी है भाई। This lower border of the scapula, कहाँ ये और कहाँ ये, कितना अंतर है जी? देख रहे हो? This is the 7th rib level. हम तो 11th रिब पर तो 11th रिब पर तो लिवर 13 आएगा।
ओके सर,
बहुत अंतर है, बहुत दूरी है।
ओके सर, ओके सर, थैंक यू सर।
आप बेंगलोर में रहते हैं? विशालाक्षी, आई फ्रॉम बैंगलोर।
सॉरी सर, तमिलनाडु।
तमिलनाडु, ओके। ओके, डन फॉर टुडे। आज की क्लास को हम विराम देते हैं। अब हमारी अगली क्लास होगी मंडे को। थैंक यू सो मच। गुड नाइट। अब हमने सीखा TADI, ताड़ी, प्लस स्ट्रीम। अब हम स्ट्रीम पॉइंट की बात करेंगे। देन लुमसू मीन्स लियो कनेक्टिंग पॉइंट, म्यू फ्रंट पॉइंट and backsu point, and soxy source point, the G clef point, all point will be coming together. So first 8 class will be complimentary for all. After that it will be only for enrolled participant. Okay, so let's close the session and see you on Monday. But any person who is even enrolled or not enrolled, having any doubt of the 8 class, they are free to ask. They can ask me. Okay? They can WhatsApp me. They can ask during the class. Okay. Thank you so much. Good night. See you tomorrow. कल मिलते हैं। कल मीन्स मंडे को मिलते हैं।